Good morning everyone. So here we are demonstrating a simple technique of suturing in which we are demonstrating simple interrupted vertical mattress, intradermal suture as well as running continuous suture. So all these type of suturing technique we are using at some different site. So there are some principle we always think while we are applying the suturing. So in case of simple interrupted sutures, it is something to close the wound. So when we are removing something, we have to close the wound. So simple interrupted suture is the simplest technique of closing the wound. We are pricking from right margin, left margin and giving the knot so that the wound is closed. Now if we see the basic principle, the distance from the wound margin should be at least 4 millimeter away from the wound margin, and the depth of suturing should be up to the base of the wound. So this is the principle by which we can obliterate the wound completely. So if I demonstrate on the silicone sheet, so here these are the instruments which are commonly we are using. So this is the ordinary needle holder and this is Castroviejo needle holder. Now the difference between two, Castroviejo needle holder we are using for the smaller surgeries in which we are using smaller needle. Suppose if we are using 60 ethylone material in which the needle is 13 millimeter. So for this smaller needle it needs smaller Castroviejo needle holder. If I use ordinary needle holder, it will give straightening of the needle, so it is not advisable. For the smaller needle I will be using the smaller Castroviejo needle holder, and this is Castroviejo scissor for cutting the suture, and this is iris serrated forceps. Now why serrated? Because it can hold the margin firmly. While I hold the margin, there should be a proper grip to the surface, so it can hold the margin properly. So first I will go for simple interrupted suture. So this is a holding of your needle. So it is at the junction of anterior 2/3 and posterior 1/3. And if I see in this view, the needle position as well as the blade of Castroviejo needle holder is perpendicular to each other, and I am holding it firmly so that the suture do not slip from the hold. While I land on the skin, my position of the needle is perpendicular to the skin surface, going inside the skin up to the base of the wound, exiting on other side of the wound and holding it with forceps and taking the needle out. Now here if you can see the needle inside the wound, it is up to the base of the needle, base of the wound itself. Pulling the thread completely, then holding in such position so that the thread coming out from the index and thumb, and the rest of the thread is coming out from the little finger. Now giving the loop, holding the other second end of the thread and pulling it till I close the wound. Now rotation of the thread to fix the knot on the surface of the skin and giving second loop to give the second tie. This is third knot and this is fourth knot. Cut it. Now this is end of your simple interrupted suture. Now the characteristic of this simple interrupted suture. Now if you can see, the wound is completely closed. Second character, there is no tension created while I have closed with simple interrupted suture. The third characteristic, on the entry and exit, there is no indentation mark to create the pressure. Now indentation mark sometimes persist for the longer time when we remove the stitches, if your stitch is very much tightly applied. And the next point is your depth of the prick should be up to the base. So if we are giving the depth of the prick up to the base of the wound, there won't be any cavity left inside the wound. So if we are taking very superficial prick, there will be a cavity left below the suturing line. So when we remove the suture, there will be a collection of fluid as well as the blood. So when we remove the stitches, because of this collection, that wound is not closed properly, and because of the tractional pull, it gets separated to give you wound dehiscence or the wound gap. So this is actually not advisable to take the suturing very superficially. It should be deep enough up to the base of your wound, and the distance from the wound margin should be at least 4 millimeter from the margin. So there will be a tissue inside the wound, inside the needle prick, so that it can hold the wound properly in apposition to give proper closure.